Hi again, everybody. Dr. Jen from Hershey Family Chiropractic, and today I want to talk to you guys about where and why chiropractors take x-rays. We have potential patients reach out to us all the time and ask, do you take x-rays? How can I avoid taking x-rays? Or I am not coming to you if you make me get an x-ray, right? We get the whole spectrum. So let's talk about that for just a minute. When or would you ever trust a dentist to go drilling into your teeth without taking an x-ray first, right? So if we think about it in that context, it makes total sense, right? There's a lot of different procedures where x-rays are just part of it and we're used to it. But when we try to make that leap over to chiropractic, we're just not there yet. So let me talk to you about it for a moment because taking x-rays is important, okay? If you're getting a spinal manipulation or adjustment done, we need to understand what's going on with your body. How do we know exactly what to treat, where to adjust if we don't know what's going on with your spine? It's part of doing our due diligence and making sure that we're serving you to the best of our ability. I've had a patient come in who actually, after x-rays, the x-rays looked pretty good, but there were some issues going on right around the ribs in the area of where the gallbladder is. And so after doing some other orthopedic tests, I was concerned about his gallbladder and sent him back to his primary care, who then found a lesion on his liver, and that started that whole process. The chiropractic community is part of the medical community in that context, right? So we are not, trying to be, a gallbladder specialist. We're not trying to do or cross over into anyone else's lane, but we need to put patients into a different lane if we do take an x-ray or we do an exam and we find something that is concerning to us. And if we're not able to do those exams, to do our due diligence, we're not serving you, the patient, to the best of our ability. And we have found that, people have never seen what their spine looks like. So they come into my office and they're in their 40s, their 50s, their 60s, they're having headaches, they're having shoulder pain, they're having low back pain, and we take an x-ray and lo and behold, your neck's going the opposite direction, your low back is going the opposite direction it should be. You have curves throughout your spine that you never knew were there. And all of the symptoms that you're having now make complete sense. And then I, as the chiropractor, know what I need to do to help you. So that's not a fit for everybody. That's okay. However, I want to pose it to you that I think it is important for a chiropractor, for someone who's performing any kind of adjustment or spinal manipulation, to know exactly what's going on the inside. It's part of putting the patient first. I hope that makes sense. Have a phenomenal day. Talk to you soon.